How do you choose the best medication for type 2 diabetes? Imagine trying to find the perfect pair of shoes. Everyone's feet are different, and what fits one person well might not suit another. Choosing the right medication for type 2 diabetes works the same way. It's all about matching the treatment to each person's unique health situation. There's no one-size-fits-all answer. Instead, healthcare providers look at many factors to find the best fit. First, they usually start with metformin. This medication is often the first choice because it's safe, effective, and well understood. It works by lowering how much sugar the liver makes and helps the body use insulin better. Doctors start with a low dose to avoid stomach upset and then gradually increase it until blood sugar levels improve. Beyond that, many other things influence medication choices. For example, if someone has heart disease or kidney problems, certain medicines are better suited. Some medications protect the heart and kidneys, which is especially important if those organs are at risk. Weight is another factor. Some drugs can help with weight loss, while others might cause weight gain. Age and other medications a person takes also matter because they can affect which drugs are safe and effective. The amount of blood sugar lowering needed is another key point. Some medicines lower blood sugar more than others. For example, some drugs can reduce HbA1 degrees Celsius levels by about 1 to 2%. If someone needs a big drop in blood sugar, stronger medications like certain injections might be recommended. If only a small change is needed, simpler pills could be enough. Safety and how well a person tolerates a medication are also important. Some people might have allergies or side effects. For instance, metformin can cause stomach issues, but these can often be managed by switching to an extended release form. If side effects are too bothersome, doctors might choose a different drug. How a medication is taken also influences the choice. Some people prefer pills they take once a day, while others are comfortable with injections. Ease of use and storage are practical considerations. Cost is another factor. If two drugs work equally well, the less expensive one is usually preferred. Simpler routines with fewer pills or injections tend to encourage better adherence. For people with heart problems or at high risk, certain medications like GLP-1 receptor agonists or SGLT2 inhibitors are recommended because they offer added benefits for the heart and kidneys. If someone has kidney disease, SGLT2 inhibitors are often a good choice because they help protect the kidneys. Starting with metformin doesn't mean staying on just that medication forever. If blood sugar stays high despite the initial treatment, a second drug is added. The decision to add or change medications depends on how well the current plan is working and whether it's safe. Regular checkups help doctors see if adjustments are needed. Patient preferences play a big role too. Some people prefer pills over injections, while others might prioritize weight loss or avoiding low blood sugar episodes. The best medication plan is one made together, considering what works best for the person's lifestyle and health goals. In practice, the process begins with metformin and lifestyle changes like diet and exercise. Blood sugar levels are monitored closely. If targets aren't met, a second medication is added based on individual health factors. Over time, the treatment plan is reviewed and adjusted to keep blood sugar under control and to fit the person's changing needs. Choosing the right medication for type 2 diabetes is a careful process. It's about finding the best combination of safety, effectiveness, and personal preference to help each person live healthier and happier.